Today, we're talking about mental health awareness and when more support might be needed. The following portion of Live at 9 is sponsored by Lakeside Behavioral Health System. Joining us, Dr. Lucas Troutman, Medical Director, Child and Adolescent at Lakeside. And we're going to do some myth busting today, so it's going to be very interesting. Well, first of all, what is inpatient care?
So it's a short-term intensive level of care where people come in, get stabilized and supported, and then transition back to their home community.
Okay, and so what are some signs that you might need that higher level of care?
Absolutely. Well, if somebody is struggling with suicide, severe depression or anxiety, escalating substance use, severe behavior disorder, just really any level of distress where parents or spouses or friends feel like this person needs more support.
And so when people hear the word inpatient, there can be fear and misunderstanding. So we're going to do this myth versus fact with Dr. Troutman. Okay, so myth versus fact here. Is inpatient treatment for people who are mentally ill or described as quote unquote crazy?
So no, absolutely not. It's for people who are overwhelmed, not broken. So treatment is available at that level of care. Treatment works, and so people can come and get supported rather than locked away.
Okay, some people, when they think that if they go to get the support, they might get involuntarily locked up. Does that happen?
Right, so no, that's very rare. So what happens is people come seeking support unless someone is an imminent risk to themselves or others, like imminently going to end their lives. That would be a time when some clinician like myself would compassionately step in. Otherwise, if someone's not imminently going to harm themselves or others, it's elective. They're coming to get support, and they can choose they can choose when they leave.
Okay, is this a myth or the truth that you have to be suicidal to be admitted?
No, I mean it's a great question, but it's a myth. Like I said, escalating substance use, behavior disorder in school where you just can't function because of any type of behavioral disorder, severe anxiety or depression, anything that's overwhelming that person, we can support through inpatient care.
Okay, myth or fact, you literally are just, it's just you and the room, no freedom like Wendy Williams.
No, it's beautiful. Wall to floor to ceiling windows, supportive trauma-informed care, family-centric care. Back in the old days, there are certainly lots of movies about inpatient care that created a stigma, but this is a bright, vibrant, lovely local resource.
Okay. Fact or fiction, can you talk to your family?
Absolutely.
Okay.
Family treatment and therapy and family sessions are a big part of care. You call your family. They actually come on site to visit you socially, as well as family sessions therapeutically.
Okay. And also, fact or fiction, could people find out?
So HIPAA is very, very locked down, confidential, and protected. Mental health records are some of the most protected records in the United States. So no, people come and get discreet, confidential care that nobody finds out about.
Okay, call the number, check the website, or, those are ways to engage, right?
Absolutely.
Okay. All right. Well, thank you so much for this myth-busting, rapid-fire session with all the burning questions people have. Dr. Troutman.
Thank you, Kanji. It's my pleasure.
Yes, and the preceding portion of Live at 9 was sponsored by Lakeside Behavioral Health System.